Hi, this video is to teach you how to use kinesio tape in order to help with torticollis. And torticollis, I'll explain in a minute, is a tightness of the sternocleidomastoid muscle. It also will assist if that torticollis has caused plagiocephaly, which is a flattening of one side of the back of the skull. So first of all, let's talk about the sternocleidomastoid. That is the muscle that tends to be too tight on one side of your neck. And frequently, if one side is very tight, then the other side of the sternocleidomastoid is possibly too weak. So we go with that assumption and we treat one side for tightness, and we assume that the other side might be a little weak because that tight side's been pulling so hard to one side. So a couple things to note, and I'm going to show you on me, it's easiest, where is the sternocleidomastoid. So if I rotate my neck to one side, you see this large muscle right here. You can also see it if I bend to this shoulder. Seems to start here, comes up, ends behind my ear. That is my sternocleidomastoid. You have one on each side. So what does the sternocleidomastoid do? Before we tape, important to know some basics. First of all, it's a big muscle, and it's a big muscle with a big name. So in case you're going to be looking it up, that is how you spell sternocleidomastoid. And in the literature or in research, you'll hear them called the SCM. That's frequently how I will refer to it in this video. It is important, although I know you don't need to know anatomy and where everything is, it's important to understand this muscle as far as what does it do for your child, and also where does it start and end. So let's review that now, and I'll review it in the video as well. So first of all, it does two primary actions related to what we're talking about today. It bends or flexes the neck to the side, and at the same time that it can do that, it would turn or rotate the neck to the opposite side. So for today's video, I'm going to assume this is a right-sided torticollis, and that this child behind me's sternocleidomastoid on their right side is too tight, causing the neck to bend to the right and possibly also rotate to the left. So if for some reason you're watching this video and your child has the opposite problem, they're bending to the left or rotating this way to the right, then that would be a child that you should be taping and just using everything I teach you today in reverse. So again, right-sided tightness will cause bending to the right shoulder and possibly rotating to the opposite left shoulder. Okay. Again, for the taping, it is important not to be exactly on the points where it starts and ends, but just want to let you know where does it start and end. So a starting point for any muscle is called the origin. It's important because for this, I want you to think about origin starts with an O. If you start your tape where the origin is, you tend to turn that muscle on or make it work harder. And for the sternocleidomastoid, roughly, grossly, it starts at the top of the sternum and at the end of the clavicle. So on me, this big bone right here on your chest is your sternum. It starts at the top of the sternum, and this is your clavicle, end of the clavicle, right about there. You don't have to be exact, but that's where it starts. And again, origin starts with an O. Important to remember for our taping, that means to turn a muscle more on, you start it there. Where's the insertion? Where does the muscle end? An insertion starts with an I. And that's important to remember because that'll cue you to remember that if you start where the insertion is, it's going to inhibit that muscle or cause it to work less and relax. And that's important when you're trying to get a muscle that's tight to relax so you can stretch better. And that insertion for the sternocleidomastoid is the mastoid process on the skull right behind the ear. Not important to know, but that part of the skull is called your temporal bone. So if you turn, you can see it, it comes up and it's right behind the ear where that bump of the skull is. That's your mastoid. So origin is here, top of the sternum, middle of the or end of the clavicle. Insertion is behind my ear at that skull point. Roughly, it's called the mastoid process right here. And again, if I start my tape at the origin and I end it here because I started where the O is, origin, it's going to cause that muscle to work harder and turn on more. That would be for the weak side. If I start my tape here, that's where the insertion is, starts with an I, we're going to inhibit that muscle, cause it to relax more and shut down more. I would then pull the tape and end it here. That would be if it was the right side is tight. So again, on our display today and for our demo, we are doing a right-sided torticollis. This child's going to be tight on the right side, tending to kink the neck to the right, possibly also rotate to the left. And because I want this side to relax more, I need this, it's too tight, it needs to relax. I'm going to start my tape on the insertion for inhibit, relax, and I'm going to bring it down and end it on the origin. Okay, so let's get to work. I tend to use kinesiology tape, the actual KT tape. They have different brands. I don't use the one that's a rock for infants because it's just got a very, very strong adhesive that's more for sports people. So get your basic Kinesio tape classic. I tend to buy it in 2-inch rolls because I can cut it into any type of length or width I want. And I tend to get the waterproof because it'll last longer. Once you apply KT tape, it will last 3 to 7 days. With babies who sweat or they're getting wet from burping or milk coming down, maybe 3 days. It's important to first cut a very small strip, put it somewhere on the baby. I usually go to the back where they won't reach it, and leave it there for 12 to 24 hours. Then take it off and see if you have any reaction with a rash. That way you're not going to be taping the neck, take it off 3 days later and find out there was quite a bit of rash, which would be a reaction to the adhesive. Kinesio tape has no medicine in it. It works based on the way that the fiber, which is a cotton fiber, has been fabricated to stretch in a certain direction. Can be used for lots of things, but again, today I'm only teaching you one thing, and that is how to tape for this type of tightness of a muscle, specifically the sternocleidomastoid, related to torticollis and a little bit of plagiocephaly. Okay, so do your test strip for sure. That's really important. If the baby has a reaction and it's red and swollen and a little bit irritated underneath it, that you think, whoa, that's a bad reaction, you can put some hydrocortisone on that skin where that reaction is and it'll go away. But I would not tape a child who has that reaction. Some infants just need more time for their skin actually to mature more before you can place this on them. Other infants, I've taped these early as 2 weeks in a neonatal intensive care unit and had no problems. But do your test strip first. And it's important to know that whenever you're going to take Kinesio tape off someone, you need to make sure it's very wet, maybe give the baby a nice bath, and then use baby oil or lotion to rub the area where the tape is and slowly just rub it off. Don't peel it off like a Band-Aid. It tends to pull the skin too tight. You want to rub it as it's wet with some lotion, baby oil, and just sort of slough it off. Okay? And then after I tape, I usually give the skin at least 24 hours of no tape if I'm going to reapply it. For torticollis, the average length of use is about 3 weeks. I tend to use it on and off for 3 weeks to get what I need. And I can give you further direction on how you should tape, whether you're turning a muscle on or off, and what point do you switch your tape to some different method. We can do that through our consults. But basically, it's about a 3-week process. And every time you've taken that tape off because it's no longer sticking or lasting, you give the skin 24 hours of no taping so that it has a chance to recover. Okay. When you cut Kinesio tape, you don't cut it straight across. You always cut so that the border is rounded. Rounded borders tend to last longer, okay? And so never cut straight across, do a rounded border. And the other thing about it is when you're using the 2-inch rolls, we don't really cut as far as length. If I needed a short piece, we don't cut this direction for a short piece. We always cut up the seam of the fibers this way, all your cutting is done in this direction. Okay? So if I have my display, and this is my wonderful doll, she has a right-sided torticollis. She's tending to want to bend or flex her neck to the right side instead of keeping it in midline. You're playing with the baby and you notice frequently she's over here. You might also notice when you try to get her go this way, it's tight. She doesn't want to go to the left. The other thing is, depending, if it's mild, you tend to just see a little tilt. If it's more than mild, you might also notice she likes to look to the left side further and more often, and might have some difficulty turning to the right. So if you see a child who's bent a little bit to the right and maybe has a preference for turning left, that is a right torticollis. So I already have a test strip on her, but I'll teach you how to do this. You can see I started my, well, I shouldn't say I started. I looked at, she's tight here, right-sided torticollis. I want to loosen this muscle, get this muscle to relax. So I want to inhibit it. So what I did on her is I started it at the insertion for I, inhibit, and I taped downward in that direction towards her origin. Only put one piece on right now. I'll show you the other piece on the other side in a second. So again, because she was tight on the right, I want to relax or inhibit. So I start at the insertion, that mastoid process behind the ear, and I tape downward towards the origin or that sternum clavicle. Whenever you tape, if you can get a little stretch on that muscle, it works better. I have her sitting up today for this demo, but as you imagine, it's an infant. You wouldn't be taping her sitting up. You'd actually maybe relax that neck ahead of time and stretch it out a little bit, however you've been taught to do your neck stretches. You'd probably have her flat on her back, and somebody could assist you to slowly pull that neck towards the left, maybe rotate it while you applied your tape. Getting the baby's hair out of the way a little bit. Okay, so we do that. We're relaxing this side, but now we want to turn on this side. If this side's tight, the assumption and most common thing is that the other side is actually not pulling enough to get that neck over here. It does no harm to tape something assuming it's weak. If it's not going to do anything bad to it. So to tape that side, I'm going to lie that baby down. Here's my little test strip. I want this left side to turn on more. Origin starts with an O, on. When you rip your tape, just rip the paper, peel that off. I typically start, I hold it down with my thumb, and when you pull off the rest of the tape going towards where you want to place it, it's called paper off tension. You're not pulling with all your might. You're just doing a nice gentle pull towards that insertion. And again, why did I start here? On. I want the left side working harder. On the side I want relaxing, I actually start at the insertion and come down. So review. Right-sided torticollis. This right SCM is working too much. I want it to relax. I'm going to start my tape at the insertion and take it down to the origin. But then on the other side, I'm assuming the left-sided SCM needs to work harder. I want to turn it on. I'm going to start at the origin. I'm going to take it up to the insertion at Peds Teletherapy. And we'd be glad to give you a first visit is a 20-minute free consult. And then after that, we can check into insurance if your child needs more than that. Hope this helps, and we'll see more videos coming online for other areas that we can help you in, instruct you in, or support you with progress with your child. Thank you.